Our first speaker is Dr. Raju Gottumukkala. Raju worked on his dad's farm until he was 13, growing shrimp and coconuts. When he can sleep at night, he enjoys watching YouTube about life in the most crowded place on earth and coldest. So with that, let's introduce Raju Gottumukkala.
Thank you, Kumar. Good afternoon, everyone. So the title of my talk is Advancing Decision Making from Visual Analytics to Augmented Intelligence. All right. So this is a well-known statistics. US ranks the last among all the developed countries in terms of health outcomes, while our per capita expenditure is the highest in the world. And our state, Louisiana, ranks at the bottom, right, 49th and 50th in many quality indicators. And we see AI has the potential to have a transformative impact in healthcare in a big way. So today, you've seen how far AI has, come in terms of healthcare. You can go get an AI mammogram for $60, right? So AI is applied almost in every domain of healthcare, from clinical applications, patient-facing applications, early detection and preventative care, population health, and so on. While there is no good reliable study to estimate what the cost savings would be, there was a recent study that showed how just the Gen AI, the impact on cost with just using Gen AI is going to be $200 to $360 billion annually by 2026, and 35% of this cost savings would be from automating some of the administrative tasks, and that is quite significant. It's like 0.25% margin, right? That's how much it's going to save for hospitals. In terms of impact on quality, I think there are a lot of studies that are coming out recently. I mean, these are not, studies on a small group of populations, but like millions of patients, right? So these are some exciting studies that are coming out. And one of these studies, for example, from Harvard called the Chief model, it's an AI model that was trained to detect 11 cancer types with 94% accuracy. Okay, so there are studies like this coming out, for not only cancer but for Alzheimer's, cardiovascular risk, EKG AI, and so many of these. And so we've seen the impact on cost and potential impact on quality due to potentially reducing medical errors. So AI can also have a significant impact also on health access, because AI is everywhere and is available anytime, isn't it? So I think integrating AI into telemedicine, wearables, mobile health, and electronic records is likely to have a huge impact in improving, in bringing care to underserved areas. Because again, AI is ubiquitous, right? It can be available anytime, anywhere. Healthcare would become more affordable. And also with good engineering, you can also provide continuity of care, all the way from the hospital to the home, to the specialty clinic, to the ER. And AI has the ability to also reach underserved population, addressing rural health and so on. But bringing AI is not going to be easy. It's going to be quite challenging. There are issues of trust. The AI models are black box. They're not transparent. Again, with privacy and HIPAA regulations, our health systems are fragmented, right? So if you want to build a generalizable model, you can't just train it on one demographic or one hospital system, isn't it? So we need to figure out how to address all these technical and logistical and organizational challenges right, to build this new AI. And there is also gaps in terms of how to integrate AI into existing decision-making process with the doctor, with the clinical workflow. And of course, there is a huge gap in ethical guidelines with using AI and so on. So these are big challenges, and some of my past work has been in the area of visual analytics, which is really addressing how to deal with big data, essentially, right? Data that's large, high volume, variety, and so on. And we've done a lot of work in that area through one of our NSF centers that I was part of. And this was an MRI award to actually build a visual analytics system for data streams. So how does this work? So today you can use Tableau and you can create nice dashboards easily, right? Whereas with data streams, sometimes you're using real-time data like from social media or sensor streams, and you may have to go and change the visualization technique, the model parameters, the data source. So we kind of provide an interface to manipulate and manage these big data workflows. And these are a couple of applications where we applied it for event detection and social media, where you're not only seeing the emerging events, but you can also go and adjust the different processes in the big data workflow or pipeline. And we've also applied that for monitoring river networks, where we took the entire USGS sensor network and we built a model to visualize and also do some analysis on top of it. The other work in visual analytics is during COVID, we worked with the city of New Orleans, where they needed help with making data-driven decisions, not to predict COVID-19 because there's like 1,000 models are out there, but they want to know like, okay, where do I distribute my face masks, right? Where do I go and inspect if people are following COVID-19 protocols? How do I reopen the economy? What sectors do I open, right? These are all hard questions, and we don't have any good knowledge on how to do this, right? So this was all new. So we've actually collected over 20 different data sets from various organizations, and we ran these AI models on a day-to-day basis to give them, to help them make these decisions. And so we kind of developed this dynamic risk model that is changing based on changing data, like on mobility from cell phone data and the COVID-19 cases and a lot of data from the city. So I thought that was pretty impactful. So that's a sample of some of the work that we've done in visual analytics. So now when you talk about augmenting intelligence or intelligence augmentation, so I think we're in a completely new world now, right? So where there is much more automation than before. And I think there are some things that the humans are good at, like creativity and intuition and things like that. And then there are some things that machines are good at, right? So the augmented intelligence is really about bringing both of these intelligence together, to kind of create human-centered systems. So there's a lot of commonalities between visual analytics and augmented intelligence. And augmented intelligence borrows things like the human-centered design, visualization, and all of these. But it also extends human decision-making in many different ways, provides better, I think with augmented intelligence, you also need to be able to provide explainability, right? Not only that the decision is made, but how it was made, and more autonomy and so on. So why does it make sense for healthcare? Because they need evidence-based decision-making. And healthcare decision-making is multifaceted, as I've been learning, working with Auctioner and several other doctors. They actually look at so many different data sets, right? I mean, EMRs, charts, plots, and so it's very, so many different data sets, and it's very multifaceted. And also, a lot of it, what I also learned is that a lot of this decision making is also based on intuition, not just based on data. So I think kind of bringing both of these worlds together can help minimize failures and errors, right? So there is bias in human decision making, and humans make mistakes. So AI also has bias, and AI can also make mistakes. So how do we really bring these together is really the my current decision, current focus in research. And I'll kind of give some of the preliminary work that we've done. So one of these is we've done a study using wearables, autopolis general, to do stress detection using AI. And part of this is how do we make it easy for nurses to participate in the study during COVID-19, right? Because we don't want to take that time away from saving people's lives. So we designed a nice system, right, where they had to spend just less than 5 minutes to answer a survey, and we published this data online. The first such study that was done during COVID-19. We're also working with our good friend, Mr. Charles Edwards, to integrate telemedicine and AI for Medicaid population to evaluate outcomes. My colleague, Dr. Ravi, is working on LLM augmented patient triage to minimize patient deterioration. So augmented learning is not just about automating it, but also learning from each other. So this is kind of a new research topic that I'm exploring. And one of my students in mechanical engineering, Sunjin, he kind of developed this concept of emotion adaptive game playing robot, where the robot is learning not only, it's also learning and observing the emotion of the player and the level of the player, so that the robot can better make the game more interesting for someone who is playing checkers. So that's the thing. So this is a new center we're creating called Accessible Healthcare Through AI Augmented Decisions. It's an NSF proposal, a program that we're putting together in collaboration with 3 other universities, Tulane, Georgia Tech, and University of Florida, and Tampa University. So we are leading this center. And so I think this is going to be use-driven research, industry-focused research. So we're working with a lot of healthcare organizations like OneTelemed, like Auctioner, like LEH. So these are our research focus areas for the center, and we have over 40 researchers from all 4 institutions. So if you're a researcher and you want to work in the area of health and AI, you want access to real world clinical data, you want to do some impactful work and passionate, and you are looking for a collaborator, or you want to participate in R&D proposals, you can reach out to me. We have to recruit close to 50 companies, health organizations. So if you're interested to partner with AHEAD, please let me know. Thank you.